lovers, welcome back to my channel. It's me, Nurse Adorable. Today I'll be talking about urinary tract infection. Kindly watch this video till the end.
Urine status. So now, talking about urinary tract infection. Urinary tract infection is caused by pathogenic bacteria. When we say pathogenic, means infection causing microorganism that causes infection. We should know that it's not all microorganisms that causes infection. So the pathogenic ones are the ones that causes infection. So urinary tract infection is caused by pathogenic pathogenic microorganisms. So it can be generally classified as involving the upper urinary tract infection or the lower urinary tract infection, which means that urinary tract infection can be classified either to be a upper urinary tract infection or a lower urinary tract infection. Also, it can be classified to be complicated urinary tract infection or uncomplicated urinary tract infection. I believe you are enjoying this video. I believe you are enjoying this video, and if you do, kindly give me a thumbs up. So now let's talk about the roots of infection. The root of infection, like how the microorganism, this pathogenic microorganism, how they get into our system, into our urinary tract. So now it can be through transurethral routes, which means that it is from an ascending infection, like the infection that moves from the lower part to the upper part. So that is the transurethral infection, and it can be through the bloodstream. The infection can be through the bloodstream, and it can be as a result of fistula from the intestine. Fistula means an abnormal connection between organs. So this can be the three ways in which a urinary tract infection can get their way into the urinary tract. Yes, the three ways through which the pathogenic microorganisms can find their way into the urinary tract. Yes, so the most common route of urinary tract infection is through the transurethral, in which often from the fecal contamination. So when there's fecal contamination, there's colonization of the periurethra. I've said the urethra is the tube that passes out this that makes urine to get out of the body. So there can be infection, there can be colonization of this area by fecal matter. Fecal content means the feces, because of the way, especially in women, the way in which our urethra and our vagina is located. Our urethra is embedded in our vaginal orifice. So then the location of our anus to that urethra, to our vaginal orifice, the urethral orifice, is almost very close. So there is always every tendency that there is fecal contamination from that area into the urethral orifice. And if proper cleaning is not done, if proper genital hygiene is not done, there can be ascension of microorganisms from this fecal matter into a urinary tract infection. So now it means that it is likely that this is mostly common in women that are sexually active. Women that are sexually active, it is common because during sexual intercourse, these bacteria are forced from the urethra into the bladder. This happens during sexual intercourse, and this accounts for the increased incidence of urinary tract infection in sexually active women. Now let's proceed to the signs and symptoms of urinary tract infection. Half of all patients that experiences urinary tract infection, they do not present with signs and symptoms. This is somehow alarming. So it is important that is why in one of my video that I made, I mentioned that it is important that when I was talking about how to live a healthy lifestyle, I made mention in that video that it is important that we go for regular medical checkup. You can imagine that someone can be experiencing urinary tract infection, and that person will not have any signs and symptoms. So if the person has not gone for a general medical checkup, how would that person know? So it is important that we go for a medical checkup regularly as we can, so that any illness or the other present in the body will be detected. So now, just as I've said, that half of all patients that experience urinary tract infection may not present with any signs and symptoms. So now let's talk about few of the signs and symptoms of urinary tract infection. So I'll start with cystitis. Cystitis means the infection of the bladder. I've said that it is the bladder that stores our urine for some time. When it's being released from the kidney, it passes through the ureters into the bladder. So the bladder stores this urine for a while before the urethra takes it out of the body. So now, when there is infection of the bladder, when there is inflammation of the bladder as a result of the invasion of pathogenic microorganisms, we have the following signs and symptoms. The first one I'll talk about is a burning sensation on urination. When you notice that when you are urinating, you feel a burning sensation at your urethra, while you are urinating is a sign of an inflammation in the bladder. Then when you have urinary frequency more than every 3 hours, you are avoiding, you are urinating, is a sign of urinary tract infection. Then urgency in urination, like you feel to void, you feel to urinate just now, and you're already having that feeling to rush down to the restroom to do that. It is a sign of urinary tract infection. So that is a sign of urinary tract infection. So also when you are awakening in the night, often to ease yourself to urinate, that might be a sign of urinary tract infection if it is not a sign of diabetes. So now incontinency means that you don't even have the power to control your urge to urinate. That when you feel a little urge to urinate, already you are urinating on your body, is a sign a of cystitis, that is the inflammation of the bladder. So pelvic pain, urinary tract infection is a form of an inflammation. It is the inflammation, just as I've said, that cystitis is the inflammation of the bladder. It is the infection of the bladder. The infection of the bladder leads to make it results in making the bladder to be inflamed. And one of the signs of inflammation is pain. Pain is a sign of inflammation. So a person experiencing cystitis, inflammation of the bladder, pelvic pain may experience pelvic pain and also back pain. So now, especially those that experience pyelonephritis, they may experience a flank pain at their back, something like that. So now, then another sign is blood in urine. Blood in urine. It may not be present in all situations, in all cases, but it is also a sign of a urinary tract infection. So now, let's discuss the risk factors of urinary tract infection. When I say the risk factors of urinary tract infection, I mean the factors that can predispose one to having urinary tract infection. So I'm just trying to make this video as short as possible and also as comprehensive as possible, so that we will be able to gain one or two things, and we'll be able to make a right decision concerning our health, especially when we feel any of the signs that I have mentioned earlier concerning urinary tract infection. So now, talking about the risk factors of urinary tract infection. Being a woman is a risk factor. I've explained it earlier. Being a woman is a factor or that predisposes one to having a urinary tract infection. That doesn't mean that the men do not experience urinary tract infection. It's just that it's mostly common. It's most common in women. Then inability or failure to empty the bladder completely. So just let's take for an example. I have a glass of water here. And I decide to empty this cup. I decide to empty this glass of water. And let's just say, let me take some. So now, I have been able to empty this cup of water to this level. I have not emptied this cup completely. Now, if I should take this cup of water and I set it aside, and I leave it, let's say, on my cabinet for days. I leave it on my cabinet even for hours or for days. What will happen to this water inside this cup? This water will be contaminated, because everywhere around us is filled with microorganisms, especially the pathogenic microorganisms. So now, when I leave this quantity of water in my cup, in my glass, and I leave it there on my cabinet for hours, for days, microorganisms will thrive in, and this water will be contaminated. This water will no longer be safe for drinking. And when it is contaminated and it is ingested, or we drink it, it will lead to another thing in our body system. It can lead to a gastric infection or any other ailments. So also the bladder. When you are unable to empty your bladder completely, so the quantity of urine that are left behind, they will be there for a longer period, and it will, already urine is a waste product. It's a waste product that is supposed to be passed out from our body. So now, when this quantity of volume of urine is left behind in the bladder, microorganism thrives in, and it can make the wall of the bladder to be infected, causing inflammation in the bladder, causing cystitis. I hope you are following me. So when there is inability or failure to empty the bladder completely, this can predispose one to having urinary tract infection. So ensure that whenever you are pressed to ease yourself, try to do that as soon as possible. It is not good to store urine in your bladder for a very long time. It predisposes you to having urinary tract infection. Also, when you are when you are avoiding, when you are urinating, make sure you don't, maybe you are in a hurry to attend to one thing or the other. Just okay, let me just quickly release this little one and go back to what I was doing. No, 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 no. Make sure that you take your time to empty your bladder completely to avoid infection process in your bladder. So now let's talk about another factor is obstructed urinary flow caused by congenital abnormality. Congenital abnormality is the abnormality that occurs in children in utero, in fetus, in utero, while they are still in the uterus, when they are still in the womb. So there can be an obstructed urinary flow. Maybe something has obstructed their urinary tract. So when they are born, this will not enable them to be able to urinate. So this can be done through surgical procedures, and the baby will be fine. So bladder tumor, when there's abnormal growth is a kind of, is a tumor. It can be cancerous and it may not be cancerous. So that may lead to urinary tract infection. Then kidney stone, immunosuppression, catheterization. Immunosuppression is when there is a compromised immunity. When there is compromised immunity, like a low immunity, so that can lead to urinary tract infection, because ideally when there's invasion of an infection, what our immune system supposed to do is to fight that infection. But when there's immunosuppression, this may not happen, and this occur in, I said it earlier that there are some people that may not experience signs and symptoms. It is when our immune system fights this infection that we experience some of this pain, like body sensation, like pain in the pelvis, like even high body temperature. We may feel fever. So but when there is immunosuppression, that means the immune system is not fighting the infection. Such person may not experience any signs and symptoms. I hope you're following me in this health education. And if you have been enjoying this video, kindly give me a thumbs up, and please do not forget to subscribe to my channel. Then diabetes can be a risk factor for urinary tract infection. Then pregnancy, urinary tract infection is very common in pregnant women. May God help us, we women. So now, neurologic disorder, when the neurons are not functioning as they're supposed to function. And it's these neurons that will pass the information to the brain. The bladder is supposed to be emptied at this point in time. Then from the brain, there will be signal, and everything will happen just within seconds. So but when these neurons are defect, when there's defects in this neuron, it makes the emptying process of the bladder to be affected. So now let's talk about how to prevent the recurrence of urinary tract infection. Preventing the recurrence of urinary tract infection involves some processes. We start from hygiene and personal hygiene. Let's take good care of our genital areas. It is very important. Then shower rather than bathe in the tub. When you bathe in the tub, there is all tendency that bacteria from the bath water may enter to your urethra. So when you bath in the tub, there is tendency that the bacteria in the water will ascend and enter to the urethra. So after each bowel movement, still talking about hygiene, after each bowel movement, make sure that bowel movement, I mean, when after you might have finished defecating at all time. Defecation means bowel movements. So after each bowel movement, clean your perineum and your urethral meatus. The urethral meatus means your urethral orifice, the opening of your urethra. That place where urine passes out from your body is the urethral meatus, the opening of the urethra. So you clean from front to the back. Now your urethra, you clean from the front to the back to prevent infection going into your urethra. You don't clean from back to the front. Our anus is at the back. When you clean from back to the front, it may bring some fecal content into your urethra. So it is important that you clean from the front to the back. Wipe from the front to the back. Or if you're washing, do that from the front to the back. And this will prevent some fecal matter entering into your urethra. So that is that about that. And now let's talk about being able to talk about hygiene. Now let's talk about fluid intake. Water do a very great job in keeping our urinary tract healthy. So it is important that you take enough fluid, take liberal amount of fluid daily, take liberal amount of water daily. It helps to flush out bacteria from the urinary tract. Now avoid coffee, avoid tea, avoid cola, avoid alcohol, avoid all drinks that can irritate your urinary tract. Make sure you avoid it. It is important. So then now we've been able to talk about fluid intake, we've been able to talk about hygiene. Now let's talk about voiding habits. Voiding habit, that is urinating habits or urination habit, whichever one. So now void every 2 to 3 hours during the day. Every 2 to 3 hours during the day, and completely empty your bladder. And completely empty your bladder. Sometimes these days when I'm at work, I'll just remember, it's been hours. I've eaten and I've not, I've not void. I've not urinated this morning. What I'll just because maybe I've been busy doing one thing or the other. What I do immediately is that I rush down to the restroom to let it out, because I want my urinary tract to be healthy, because I don't want to start nursing infection. So yes, there's something important I will still want us to talk about. Let me quickly brush up this. So now make sure you void every 2 to 3 hours during the day, and make sure when you urinate, make sure you do it completely. Don't leave some volume of urine behind in your bladder. So women should urinate immediately after sexual intercourse to flush out any opportunistic microorganism, pathogenic microorganism that might have find their way into that area. And that is very important. Now for those that have been battling, for those that this tip is for those that have been able to watch this video till this time. I'm giving you a thumb up. So now this aspect, so now just as I've said that this aspect is for those of you that have been able to watch this video till this time. Yeah. Now, if you have been battling with urinary tract infection, or you have just been diagnosed of urinary tract infection, or you have someone close to you that have been diagnosed of urinary tract infection, what to do is that you do not do self medication. Oh, this is what my friend experienced last week. She took these drugs, or this is what my sister experienced some months ago. These are the drugs she used, so now let me use it. Or this is what my brother experienced last week. These are the drugs he used, let me use it. No, 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 that is totally wrong. I mean, it is wrong when it is wrong. Yes. So what to do is that you go to the hospital. It is likely that maybe you diagnose yourself. Let me just put it that way. Maybe you have diagnosed yourself of having a urinary tract infection, because I really believe that when you go to the hospital and the doctor suspects you have a urinary tract infection, maybe because of the medical history you have given to them, they will send you to the lab to do a urinalysis, to do urine test. So now what to do is that when you are being sent to the lab to do urine test, make sure you do it. A urinalysis will be done and MCS will be done on your urine. This MCS means microscopic sensitivity and culture, microscopic culture and sensitivity. So it will help them to know the exact microorganism that is causing your infection, your urinary tract infection. And also it will enable them to test this microorganism against some antibiotics. When they test against these antibiotics, they'll be able to know the one that is most suitable for your treatment. Because if this is not done, and you just go to the chemist and get this drug and get that drug and you start consuming it, it is very hazardous to your health. It is very hazardous to your health. So you need to take all these measures that I'm giving you. When the right test is done and the right drug is given to you, this infection will be treated once and for all. But when you start taking, maybe you just call one person somewhere, oh, this is what I'm experiencing, and the person just say, use this, use that. It's totally wrong. Because the drugs that works for you may not actually works for you. It may not be the same microorganism that have caused my own urinary tract infection that will cause your own or that have caused your own urinary tract infection. So don't let us waste our time using different drugs. Because all these drugs we are taking, they have their own adverse effects and side effects on our body. As they are doing good things by treating our ailments, they also have their own bad side. They have their own adverse effects, some a long-term adverse effect on our health. So why can't we just avoid taking this medication as often? Do you understand? So for you to successfully treat your urinary tract infection, please do the right test you have to do, and do not assume that okay, this is what I'm passing through and you start consuming drugs. So do the right thing to do and treat your urinary tract infection once and for all. So by doing that, it will help you to prevent them. While you are doing that, when the right medication has been given to you, as prescribed and be given to you, make sure you use it as prescribed. Do not skip any dose. Make sure you use it as prescribed, and as you are taking it, make sure you are taking copious water, because this water will enable you to flush out. It will flush out the bacteria and the microorganism present in your urinary system. So take enough water, and also take enough water, and yes, take enough water. Yes, thank you for watching my video, and I believe you've really enjoyed today's video. You've been able to pick one or two things in today's video. Thank you for watching, and if you have enjoyed this video, kindly subscribe to my channel if you have not done that. Like my video, share my videos, and do not forget to turn on the notification bell so as to get notified when I drop another interesting video. See you in my next video. Live healthy and stay safe. Bye.